When the body experiences a overwhelming traumatic force, sometimes what this force can do is actually move the brain within the skull. This can cause subtle damage that isn't quite enough to bruise the brain, but it is enough to impact the functioning of the brain. We oftentimes call this concussion. So with the concussion, we find that this damage to the brain can impact the function of the brain. So patients will see things like headaches, they may have visual changes, light sensitivity, hearing sensitivity, difficulty reading, difficulty remembering, difficulty when they go back to work, might have, in severe cases, they may have difficulty speaking. Many things can happen as a result of a concussion. So typically, for treatment of a concussion, the key thing is rest and avoiding another concussion. So oftentimes you might have restrictions in how soon you can return to the activity that caused the concussion in the first place. But the other thing that we want to do for concussions is make sure that we allow the brain to rest. As with everything in our body, the body does present with an extraordinary capacity to maintain its health and to heal itself. We just have to get out of the way. A common thing that I find my patients doing that really slows down their recovery from concussions is watching TV and staying on their screens. The screen time can slow down the progress that patients make in their recovery from the concussion. In fact, oftentimes I restrict the amount of screen time patients have to an hour or less a day, depending upon how severe the concussion is. And patients are frustrated with this, but it does help the brain recover. But oftentimes patients respond very well to treatment using acupuncture and also hands-on manipulation. Because of the disruption of physiology in the brain from the traumatic event, it's not uncommon that changes also happen in the neck, which is where the head attaches to the body. Because what happens to damage in that area is we start to find that the venous blood and other fluids are not able to properly circulate within the brain and drain from the head down into the neck. So this backup of fluids causes congestion in the head, that leads to that muzzy thinking, that leads to some of the headache pain and slows down recovery. So by using some very gentle osteopathic manipulation techniques, acupuncture, and a few other treatments, but in particular using rest, we're able to help the body recover as fast as it can from these concussion types of injuries. I've treated patients that have been involved in severe car accidents, professional hockey players, etc., and all of them respond very well to osteopathic treatment as well as acupuncture.